There is optimism today in the country's fight against COVID. The average rate of new infections in the U.S. is about 38,000 a day. That's the lowest since last September. On Capitol Hill today, Dr. Fauci said that number, if we continue to vaccinate, could soon become so low that we'll begin to return to normalcy. Still, nearly 42% of U.S. adults have yet to receive even one shot of the vaccine, with hesitancy largely driven by disinformation and conspiracy theories still coming from Republican lawmakers. Dr. Fauci again had to correct Rand Paul today, this time about a false claim on his part that the U.S. funded a lab in Wuhan, China, and that it may have, in effect, made the virus more contagious. It's an assertion Fauci called entirely and completely incorrect and unhelpful to our goal. Joining us now, MSNBC medical contributor Dr. Kavita Patel, a former Obama White House health policy director. I want to start with the sublime, and then we'll get to Rand Paul. The numbers to drop below, and I remember how it felt in September. We were sort of white-knuckled about a potential holiday surge, but we had survived the summer and we were cautiously optimistic. Do you think we can keep going down?
Yeah, I do think that cases are continuing and will continue to go down in the future weeks, Nicole. Double-digit decreases, which is great. Not to mention, obviously, hospitalizations and deaths going down as well. And I think it's because not only have people been getting vaccinated, and we still need to work on that, but you're also seeing that, the restrictions and people wearing masks indoors, we now know so much more about indoor transmission, that works. So it's great news. Many of us are hoping the CDC will update guidance to start giving people relief from wearing masks when they don't need to. And that'll be getting to those percentages, 60 to 70 in your community.
And I think you're talking about vaccinated people. Let me show you President Biden seeming to hint at the same thing today.
We're just getting there now to the degree that I think you're going to see a more aggressive effort on our part to lay out that once vaccinated, it's not only you can hug your grandchildren, you can do a lot more. And whether or not you have to have, even at some point soon, mask inside versus outside.
Dr. Patel, it seems like we know, first of all, two things that we didn't know at the beginning of this. Outside is extremely safe relative to indoors, and that there is a real tension now about making clear that once vaccinated, you can do just about anything. Is that right?
Yeah, and I think that, the just about anything, and you're right to kind of emphasize if you're fully vaccinated, although I will be honest, Nicole, it's going to be hard to know who's vaccinated and who's not. We're just going to have to trust that people self kind of regulate. But anyway, you're absolutely correct that life will get a lot more normal. That doesn't mean cases go away. And I think that just needs to be clear. And so if you're like the mom of a high-risk child, or if you yourself have had an organ transplant where we know you don't necessarily have those immune levels that I do, who is healthy, that becomes a risk. And we're telling patients right now, you might need to continue to wear masks if you have one of those conditions. So I think America's just going to have to get kind of comfortable with taking on different levels of risk. And that's not something we know how to communicate very well in public health. Not something the CDC has communicated well either. And I think that's what you're hearing the president tell governors, that the governors are asking for better communication and some hope. And I think Biden's responding to that.
I want to ask you, and I've actually lost the thread on Rand Paul's conspiracy theories, but it seemed to go back to some U.S. funding for the lab. Is that still, is this battle against disinformation still sort of the last real obstacle to getting to levels of vaccination where we're all really safe and protected?
Yeah, absolutely. Buried in my bio, I worked on the Senate Health Committee when Ted Kennedy was chair, and we worked with Senator Burr, and it's so amazing. Like, I think of him, he is kind of what the Republican Party has always been. And he even said with pride, he got vaccinated, kids got vaccinated, grandkids got vaccinated. And he did what I was hoping Republicans would do, talk about the value of the vaccine, be a role model for anybody who feels like if you're a Republican or you're a white male, you shouldn't get vaccinated. And then you contrast that with Senator Rand Paul, which, by the way, he's an MD, but that somehow does not mean that he listens to objective facts. And the threat is that there has been NIH funding that has gone to different labs around the world, including labs in Wuhan. What Senator Rand Paul has done now is propagated this crazy myth that the NIH funding, and directly Tony Fauci's funding, as if he personally did it, was involved in what we call kind of gain of function research, where people do research viruses and try to understand whether those viruses can, frankly, be more potent or weaponized in some ways. Fauci, that's absolutely never been a shred of evidence linking the two, but it's like one of those things, it's like Harry Potter, like once you say the name, Voldemort, and once you say it, it's spoken. So I think that, and now that's dominating. And so there's Richard Burr, a senator who actually said and did the right thing, disagree with some of his policy points, but said and did the right thing and was a role model, crowded out by, frankly, somebody who I don't even know how he got his medical degree.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.